Welcome to Career Journeys, a series of videos by the Consortium for Public Education. Here we explore the career experiences and pathways of professionals from a wide variety of careers to help you think about the skills you'll need and the paths you might take after high school.
Hello, I'm Austin Anderson, Business Development Officer for the Forum for Workforce Development.
Hello, my name is Anthony Princeton. I am the coordinator for the Forum for Workforce Development.
And we're collaborators with the Consortium for Public Education. Today, we're interviewing Lauren Risser, a research assistant at the UPMC Children's Hospital of Pittsburgh. Thanks for joining us, Lauren.
Thanks for having me.
So first off, tell me a little bit more about your company and your role there. What do you do as a research assistant?
Yeah, so as a research assistant at Children's Hospital, I help with youth violence prevention programming for adolescents and young adults. So the research that we do is considered community-based research. So we partner with community partners like the YMCA or local school districts to bring programs to their communities and talk about things like emotion regulation and healthy relationships.
Why did you ultimately choose this kind of work?
I chose to work in public health because I was always interested in the medical field, but knew that being like a doctor wasn't a good fit for me. So when I was in college, I worked with a professor on a project about partner violence and have really been interested in violence prevention work ever since. I really like the feeling of being able to help groups of people in communities rather than other medical professions that are really one-on-one settings.
So what are some skills that you think make someone a good fit to be a research assistant?
Yeah, so being detail oriented is like super important in research. We have a ton of protocols that you have to follow to see a project from start to finish. So from recruiting your participants the whole way to data management, it's really important to make sure you dot all your I's and cross all your T's.
So what does a typical day look like for you?
Yeah. So a typical day in the office is having a team meeting and prepping any materials you might need to go to a site that day. Our sessions normally last about 3 hours, so that takes up most of your afternoon. The day after a site, you have to enter all of the data from the session, so things like attendance, payment information from participants, any surveys you collected. And then at the end of a research project, we use all of that data to write research papers that get published in journals. So I spend some time during the week writing as well. Right now, things look a little bit different with everything being online due to COVID. So we're doing some of our programming online and just figuring out how to transition all of our programming online and how to pay people online and do surveys online has been definitely a learning process for all of us in the office.
Excellent. Mm-hmm. So you alluded to this a little earlier, but what kind of post-secondary training is necessary for a research assistant position?
So I have a Master of Public Health, but you don't necessarily need a master's degree to work as a research assistant. I work with a lot of people who have their bachelor's degree. I would say some type of undergraduate degree would be helpful, but there's a lot of degrees that can be useful. My undergrad was also in public health, but I work with people who studied psychology, biology, social work. I think really anything where you can pick up research skills is really helpful.
What's one piece of advice you would give to someone aspiring to be in your field or even in this position?
I would say don't panic if you don't know what you want to do right away. I didn't know what public health was until my junior year of college, and it ended up being the perfect fit for me. So I would say ask questions, talk to people in the field, find something you're passionate about, and then really just go for it.
I'm going to ask you one more question. What's a student in high school? What can they do extracurricular activity wise to, help go forward in a position or field like that?
I would say shadowing can be really helpful. So we have a lot of times we'll have like summer volunteers and things like that that come into the office and get a feel for what we do and what it's like to work in communities. So I would say things like that you can really see what it's like to work in that field can be really helpful.
Did you shadow when you were a high school student or a college student?
So I did shadow as a high schooler, but I thought I wanted to be a pharmacist, so a little bit different. And then, like I said, I really worked with a lot of public health faculty in college. So I think just finding other people working in the field, whatever you think it might be.
I want to ask, what made you want to be a pharmacist, and now you're in this? What was the trigger to make you switch into public health?
Yeah, so when I wanted to be a pharmacist, I was really interested in doing like medication management. So like helping people understand how to take their medications and how to take them properly and things like that. So I think I've always been really interested in this like health education component that's like really important in public health. So I'd say through my many major changes in college, I think that was kind of always this like underlying theme of I wanted to figure out how to help people.
Thank you for joining us today, Lauren.
No problem. Thank you for having me.
For more information or to learn about other careers in the Career Journey series, visit our website and check back soon for our next installment. Thanks!